The National Association for Continence is proud to present this video overview of surgical options to treat overactive bladder. For most people with overactive bladder, surgery is usually a last resort and is only considered after more conservative options have failed. If you haven't yet tried behavior modification and medication, if you haven't explored the range of bladder control products available, and if you haven't already discussed advanced therapies with your physician, we recommend you first watch the other videos in this series. They'll give you a much better sense of the treatment methods available to you, and there's a good chance you'll find a meaningful degree of relief without having to undergo a surgical procedure. But what if you've already explored these options without significant improvement? In that case, surgery could be a sensible choice. Keep in mind that not everybody is a good candidate, in particular, women who may want to become pregnant. That's because childbirth can reverse the benefits that surgery provides. And even if you are a good candidate, it pays to remember that, like all surgeries, these procedures do carry certain risks. Depending on the symptoms and severity of your condition, your doctor will probably present you with one of 3 different procedures. The first of these is augmentation cystoplasty. This is a procedure that increases the size of the bladder, allowing it to store more urine. Your doctor will take a small piece of tissue from your intestine and add it to the wall of the bladder, magnifying the volume of liquid it can hold. Be aware that some who've had this procedure will have to use catheters to empty their bladders afterwards. Another surgery is called urinary diversion. In this procedure, the tubes that carry urine from the kidneys to the bladder are rerouted through the abdominal wall to the outside of your body. They still deliver urine, but instead of going to your bladder, it's collected in what's called an ostomy bag, which you wear under your clothes. As you might expect, this option does require some maintenance, but it also makes it possible for you to lead an active life post-surgery, and no one ever has to know that you had the procedure done. A third option is a sling procedure. Women may have this done to help control stress urinary incontinence, which occurs when pressure from actions like coughing, laughing, or sneezing cause leaks. They may also have it done to treat pelvic organ prolapse. Men can have it done too, usually to treat incontinence that's caused by the weakness of certain muscles or following surgery. During the procedure, physicians use a sling to reposition parts of your urinary anatomy, reducing or eliminating symptoms of incontinence. There are other surgical procedures too, so it's important to have an open, honest conversation with your physician. In the process, your doctor should make sure to explain all of the pros and cons in detail so you can weigh them carefully. Surgery isn't something that should be taken lightly, but when the circumstances warrant it, many patients find that it delivers the relief they've been hoping for. This video has been brought to you by the National Association for Continence. Visit us online at nafc.org to learn more.